Yeah.
Wonderful. So my name's Cora Dunwell-Roberts. I'm the clinical educator for one of the clinical educators with Greater Manchester Training Hub, and I'm the ACP lead at the moment for the Greater Manchester Training Hub. So just running through some information on advanced clinical practice, so a general overview, and then I can give you some details of when the next funding round is starting. Hopefully these slides are going to work. Oh. So tend to sort of slightly following on from the session that we had in the Shiny Minds, just that sort of awareness, sometimes just checking in on how you're feeling. There's lots going on, there's lots of stress, lots of negativity towards general practice, and just that awareness that this has a massive impact on sort of where we're up to. It's not. So titles, still slightly confusing sort of with all the different titles: advanced nurse practitioner, advanced clinical practitioner. We've got the advanced level nursing practitioner, advanced practice. Lots of different titles, lots of different confusion. There's still no protection over the title. In terms of the guidance that's out for advanced clinical practice, it's about having that master's, although there is that recognition in terms of people with that wealth of experience and knowledge that haven't done the master's. They might have done various different modules, degree courses along the way. So there's definitely a lot of confusion. The GPs that I work with, I've worked with for sort of many years, and they're still very confused over sort of where this is, where it sits. There's a lot of confusion in terms of if you employ someone new as an advanced nurse practitioner or an advanced clinical practitioner, where do they sit, what can they do? So yeah, still lots of ongoing confusion. So advanced clinical practice, it's more about a level of practice rather than it being defined by a clinical profession. So back in 2017, we had the Multiprofessional Framework for advanced practice, clinical practice, sorry, in England. So looking at that, how it's that level of practice, and it's not just because you've still got a lot in terms of that consideration that it's an AMP, so an advanced nurse practitioner, but it is open to the numerous other disciplines. So involved, and it's on the next slide, as part of the NHS plan, looking at how we can modernise pathways of care, looking at how we can get the best, the most experienced practitioner to actually see and manage the person and the person's needs. For us in general practice, we've got our nursing colleagues, which I'm sure sort of most of nurses sort of on here. We've also got pharmacists, that might be ACPs, mental health practitioners, paramedics, physios, podiatrists. We've also got the first contact pathways where they're leading up to advanced practice. Part of this framework is about that pulling together for consistency of understanding. So actually, if someone's going in as an advanced practitioner from one area to another, we've got that awareness of what they're able to do. Why is it important? I'm sure sort of everyone's more than aware, every area of general practice is under immense pressures. We've got higher workload, increased demand for appointments. There's increased complexity of the patients that we're seeing, increased comorbidity. There's massive issues with recruitment and retainment of staff across the board for the whole variety of reasons, and picking up on some of the stuff in the chat in terms of the complexity of terms and conditions, pay, long-term prospects that comes with general practice. We've got massive shortages of our GP colleagues. There's a lot of negativity towards them at the moment in terms of that when they're down as working part-time, though sometimes they can be working sort of full-time hours, and just that, how are we managing to meet with the massive demand that is sort of coming our way in general practice. The role was looked at back in 2019, again in the NHS plan, looking at how we can increase the number of advanced practitioners, looking at how we can utilise the multidisciplinary team a lot more. A lot of it often in general practice, and still you get a lot of patients seeing that in terms of, actually I need to see the GP, when actually is the doctor the best person that person needs to be seeing for that health condition at that time. Again, nurse practitioners have been in general practice for long periods of time, but you do still sometimes get patients when it's like, well, I've just seen the nurse and they've just done this and they've just done that. Actually, everything that they've done is often that same level of care that our GP colleagues would have done. So it's looking at as well, often with a lot of our professionals, as they move up the career ladder, they go into more management type positions. So it's trying to keep our experienced clinicians on the shop floor within a clinical role. Nurse practitioners, they've been around, or the title nurse practitioner has been around for quite a long period of time now. Started off in America, and its initial grounding was within general practice, sort of in the 80s, 90s by Barbara Stilwell. Again, similar things happening then to what's happening now, about sort of lack of staff, patients unhappy with consultation times, waiting times for appointments, and looking at sort of how we can better train and meet demand. Sorry, as my battery's going to go low. So pillars of advanced practice, often there is a lot of focus on clinical practice, but within advanced practice we are working towards the 4 pillars. So it's looking at education and learning, it's looking at leadership, and it's looking at research and development. So often there is a lot of focus on seeing patients and getting that clinical workload done, but it's that awareness we should be working towards all 4 pillars. And again, sometimes that knowledge and understanding for our employers or our GP colleagues, in terms of we need to be looking at sort of all 4. It's not, so facilitation of learning, it's not necessarily about lecturing at university. Some of that is supporting sort of learners within practice, facilitating of learning for patients in terms of that understanding of their condition. Research, that ability to appraise the evidence in terms of, just because it says that, how does that fit? What does that mean? How, when we're enabling patients to make a decision on their treatment and care, how can they make an informed choice from that research that is available? As I've already highlighted, it's looking at sort of within the job plan of the 4 pillars, and sometimes you can find that actually one person's job plan might have more education, someone else might be more management, and sometimes it could be more research. But it is where we've got all 4 pillars, and that should be included in job plans, and it should be included in the job description by employers, although it is that understanding that often the focus is definitely more clinical. There is work being done sort of nationally in terms of looking at how we can link into the different pillars. This scope and exercise being done on supervision at the moment within Greater Manchester. And if people haven't seen that, if you want to email myself or Leslie, the team at GM, we can forward you the details. They're looking specifically at sort of supervision, more for supervision of us individually as practitioners, but there's links in terms of for the educational component, in terms of that supervising some of the first contact practitioners and assisting them on their journey towards advanced practice. I'm sure many people are probably aware of the Royal College of Nursing credentialing, so that gives you the advanced level nursing practice. I think the competencies were first matched to the RCN back in 2000. There were some links at the time because it was being looked at in terms of it becoming a recorded qualification on the NMC. So they've been doing the credentialing for a number of years in terms of, again, that ability to translate what the qualification and what the standards that the nurse is doing from one area to another. At the moment, the credentialing with the RCN is only for nurses, so it's not open to other disciplines. You don't have to be part of the RCN to utilise this function, and I think it lasts for 3 years. There is a payment in terms of that goes to the RCN. They review the evidence and then sort of award, or you can work towards that. We've also, within general practice, we've got the advanced clinical practice nurses working in general practice and primary care in England. This was developed in conjunction with the RCGP, and is something that can be used to complement and be used alongside the Multiprofessional Framework. The focus is slightly more in terms of the clinical domain. So domain A, B and C within this document is much more clinical, but it's still acknowledging that actually the leadership, the management, the research and the education all sits with under advanced practice. It is, in terms of the document, is aimed towards nurses, but actually when you read through the document, it can be used for the other disciplines that work within general practice. And I'm aware some of the GP Ready programmes that are run at GMTH level, they're looking at the principles of this document for things like the PAs and for the other allied health professional roles. So we've got the core clinical skills. The delights of general practice is we see sort of anything and everything. So it's ensuring you've got that breadth of role and that ability to be able to deal with it. Sometimes the difficulty with some people with advanced practice is you get that I don't see this, I don't see that, I can't do this, I can't do the other. Often the way that I see it for us working with advanced practice, it's recognising our competencies, but then actually if I've got an issue in mental health, how do I upskill? Mental health is one of the ones that I always find a little bit more unusual in terms of, oh, I don't see mental health patients. Actually, in general practice, how can we not be seeing mental health patients? The majority of the patients that come to us across the board, so from our healthcare assistants to our general practice nurses to our advanced practitioners, there's often going to be a mental health component in there. So it's not saying actually you've got to do everything, but it's that recognition of competence and how can we become competent. A lot of staff within general practice are more adult trained. So there's a lot in terms of sort of child health and child assessment. Again, it's that ability, because sometimes as an advanced practitioner, you might be the only clinician within the surgery in terms of what support and learning. I have heard sort of from some people that CQC are sometimes asking what additional training people have done in terms of looking at paediatrics, and there's a variety of different support. There is recognising the sick child, which is something that you can do online. There are university courses that you can access to get that knowledge and experience. I've got some information specifically on pregnancy in a couple of slides, so we can go through that, because again, there's often that discussion, I don't see pregnant ladies. Again, that difficulty can be actually you've got a pregnant lady that's coming in with something else, their asthma or a water infection, or a variety of other things. So we've got the Centre for Advancing Practice. So Health Education England established the Centre for Advancing Practice to oversee the workforce transformation of advanced level practice. So there are 5 key functions. They're looking at programme accreditation, so the current master's programmes that they're accredited. What this means that when someone has completed one of the accredited programmes, they will go direct onto the Directory for Advancing Practice. So this is something that sits across all disciplines, so nurses and the allied health professionals. It sits within primary and secondary care. They're looking at the recognition of where people are, the education and training. How does that sit, and how does that then enable them to go on the directory of advanced practice? We have recently in Manchester had a scoping exercise looking at what training needs are potentially needed for people to go onto the directory. There's work coming out in terms of there's a supported portfolio, so some people might have done certain master's modules, they might have a wealth of experience, so it's how to bring that all together so that they can be recorded as an advanced practitioner. And looking at how they're looking at how they can continue to grow and develop sort of workforce, looking at consultant level practice. At the moment, personally, I'm not quite sure how consultant level practice fits with us in general practice, but there is work going on with that within secondary care. So we've got the Northwest faculty, so Annabella Gloucester is our Northwest lead for advancing practice. We've also got Nick Worth, who's looking at supervision and assessment at the moment. Oops, sorry. So advanced practice and care of pregnant ladies. So the RCN has a document that came out in 2021, so just this year. And a lot of it, when you read it, is about working within scope of practice, seeking advice and referral onwards as necessary. There is that recognition that sometimes emergency care, so a lady coming in with a UTI, there is that potential for that to affect their pregnancy. So a lot is that they should then be referred to get advice from their named midwife. So it's slightly less that actually, yes, we're not midwives, we can't have anything to do with any lady that's pregnant. Yes, the maternity care still needs to be done by a named midwife or a medical colleague, but it allows that scope in terms of, right, you're seeing someone who's pregnant and they've got asthma, you're seeing someone who's pregnant and they've got a chest infection. There's also advice now that the RCN enables, so if you're seeing that lady for that discussion that they first become pregnant, about if it's still within the scope and competence of practice, about prescribing folic acid for pregnant ladies. So there is clarity within there, and a lot of that is enabling and making sure that we've got pathways to support what we're doing, and then referral on as appropriate. The advanced practice scoping, as I mentioned earlier, it has now shut. You might be able to access it if we have got anyone who works in an advanced practitioner, if you use the QR code. Part of that is identifying sort of who our advanced practitioners are within Greater Manchester, and with Greater Manchester in primary care. What's needed potentially to get these people to be enabled to go onto the directory for advanced practice. There is the supported portfolio route is potentially going to be launched over the next couple of months. So there's some funding from HEE to support people to be able to do that. It's a little bit unclear how much support from HEE in terms of top-up modules, or whether people will need to do a full master's. Hopefully over the next couple of months we should have some information about that. Alongside that, in terms of getting people onto the directory for advancing practice, it's looking at how we can develop a network and peer support. There's a wealth of experience and knowledge across GM, and it's looking at how we can tap into that. As always, has already been highlighted, often in general practice it can be very isolating. Some people might be working as a single advanced practitioner. It is within that medical model, so it's looking at how we can support and share best practice. And as I've already mentioned, GM at the moment across the entirety of GM, so both primary and secondary care, there's some work going on to look at supervision. Roadmaps, so we've got all our other practitioners, so I would assume quite a few people have probably come across some of the first contact practitioners in physio, because with the ARS role we seem to have more of them. compared to the other disciplines at the moment, but there are roadmaps to support these along the journey from a first contact practitioner to an advanced practitioner, and there's support in terms of that multi-professional learning. So in terms of advanced practitioners could get involved in supporting these people along the pathway to advanced practice. Often in some of the discussions I've had, you hear a lot, oh, well, the GP's got to do this and the GP's got no time. It's sharing this workload out. We've got a wealth of skills and expertise.
Cora, just to let you know, we've got a couple of minutes left.
Okie doke.
Thank you.
So there is a first contact practitioner program, more just so that awareness to direct your colleagues onto it. They've got a wealth of experience, but it's about them becoming used to how we work in general practice. So future, we've got continued development, and there is commitment from HEE about funding for staff to go on the advanced practice pathway. The funding is generally in the springtime. We don't at the moment have any specific dates. Potentially the release of funding might be about January time. What we're doing at GMTH at the moment is looking at developing a page on the website to get that launched for Advanced Practice Week. So it's something that will be updated. Non-medical prescribing can be funded separately, or some people do that as part of the advanced clinical practice pathway. There's lots of other work being done nationally, looking at CPD needs of advanced practitioners. So it is that to be aware and to tap into that. There's a lot of exploration about that continued development. At the moment, there seems to be a lot for learners, so for people going on the advanced practice journey,